Thank you for joining me today to talk about sleep apnea treatment options. And next slide, please. So, so what exactly is obstructive sleep apnea? After we fall asleep and we drift into deeper stages of sleep, the muscles of our body relax. As a result, the tissues in the back of our throat, the tongue, and the palate collapse into the breathing space and block the airflow. Next slide. So, the typical consequences of obstructive sleep apnea that we all think about are feeling tired and fatigued all the time due to a lack of quality sleep. And this fatigue can have significant effects on our productivity and on our quality of life. But the consequences go far beyond this, and it's actually a life threatening disease. Untreated obstructive sleep apnea results in increased strain on the heart and the lungs and has been shown to significantly decrease lifespan. And putting a chronically sleep deprived person behind the wheel can be deadly to that person as well as to everyone else on the road with him. And let's not forget that the person with OSA is not the only one who's sleep deprived. The loud snoring will keep everyone else in the room awake as well. Next slide. So, specific to Down syndrome, children with Down syndrome, the rate of sleep apnea varies somewhere between about 50 and 100%. And frequently, DS kids will have their tonsils and adenoids removed for this reason. And for some, this does temporarily fix the problem. However, as these children grow into adults, the risk of developing obstructive sleep apnea continues to increase. And it's estimated in many studies that the prevalence of OSA in adult Down syndrome really approaches about 100%. There are a number of factors that make this group such a high risk for sleep apnea. There's a large tongue that falls back into the breathing space at night, as well as other differences in the breathing space that narrow it. We know that as someone gets heavier, some of that additional fat goes into the spaces around the throat and affects the breathing. And we know that DS causes low muscle tone. So the muscles around the airway are more floppy and just don't hold the breathing space open as well. Next slide. So in a high risk group of people, it's very important that we identify patients who have obstructive sleep apnea so that we can move forward and treat them appropriately. The way we diagnose sleep apnea and determine its severity is by doing a sleep study. Now, in the past, if anyone has had a sleep study in a sleep lab before, you know that this can be a bit burdensome for anyone. You have to go to a facility, get hooked up to a whole bunch of wires, and then kind of sleep in an unfamiliar bed with cameras watching you all night long. And this is really just not conducive to seeing a typical night's sleep for anybody. And even the home sleep studies from 5 or 10 years ago involved a whole bunch of wires that could fall off during the night, or you get entangled during the night, and the sleep study ends up not going as well as it could have. But modern technology has really improved this experience for the patient. And nowadays, for most patients, we can perform a very straightforward, easy to tolerate home sleep study. You wear a little device on your wrist that looks a lot like a wristwatch, and you turn it on before you go to sleep. Your smartphone just records the data all night long while you're sleeping, and then sends the information by internet the next morning to the physician who's going to interpret the study the next day. So, why is it so important that we diagnose and treat sleep apnea in folks with Down syndrome? Well, in addition to the consequences that we talked about a couple of slides ago, we know that sleep apnea will make worse some of the other medical problems that are very common in this group. Namely, untreated OSA puts additional strain on the heart and lungs, and in someone who already has an underlying heart and lung issue, these problems tend to be made worse. And unfortunately, for anyone who's already at risk of developing long-term neurological issues in terms of memory loss or language development or even dementia, we know that chronic sleep deprivation and sleep apnea will cause these symptoms to be worse and likely develop faster or at an earlier age. Next slide. So, as we mentioned before, removing the tonsils and adenoids in children with Downs is a frequent procedure for obstructive sleep apnea. And it can be effective, but often it's not enough to treat the problem. So, what can we do for folks who have persistent sleep apnea at that point? Next slide. So, CPAP. Uh, CPAP, which I think we'll talk about that a little bit more in a couple of slides, is always tried as the first option for really anyone with obstructive sleep apnea. And for those who can wear it, it can work very well. However, the problem is that the compliance can be very low. It's around 50% or so in most studies. And for a patient with some developmental issues who may not completely understand why he or she has to wear it every night, it can be even harder to get buy-in from the patient. And unfortunately, it just doesn't work unless you wear it consistently. Next slide. There are other surgical treatments for obstructive sleep apnea as well. However, they tend to be bigger surgeries with some significant risks and sometimes questionable outcomes. And while there are select situations where they may be very effective, frequently they just don't work as well as hoped. Next slide. So back to CPAP for a few moments here. Again, it's considered the gold standard or the first line treatment for obstructive sleep apnea. And so CPAP is a machine that attaches to a mask that you wear at night, and it blows positive pressure air into the nose and the throat in order to tend to open the tissue of the throat. And for those who can tolerate it, it really is an excellent option. However, as we discussed, there's a number of people who are just unable to acclimate to it. Next slide. So in the 20 years or so that I've been involved in surgery for sleep apnea, there have been many different procedures used to try to open the airway. These older surgeries have focused on removing parts of the back of the throat or the tongue or the inside of the nose in order to relieve the obstruction while you're sleeping. And on occasion, a patient may have blockage from one specific area, and the surgery works well. However, these surgeries are frequently unsuccessful because the airway is collapsing at multiple different areas, and we just weren't addressing the whole problem. And as a result, the patient would undergo the procedure only to find that their sleep apnea was really only partially treated. Next. Which is why about 5 years ago, I was still looking for a better option for my patients with sleep apnea who just couldn't tolerate the CPAP machine. And that brings us to the reason why we're really all here today. So the Inspire is an implanted nerve stimulator device for the treatment of obstructive sleep apnea. As you can see, it's a small device that's implanted underneath the skin of the chest during a safe outpatient procedure. After the procedure, it works with the muscles of your throat and tongue to naturally open the airway while you're sleeping. During the day, the device is turned off and you go about your normal life without even realizing it's there. And at bedtime, you hold a remote control over your chest wall, push a button, and go to sleep. Inspire works all night long while you sleep to keep your breathing space open and to treat your sleep apnea. Next slide. So this is a little video we're going to run just to show how it works. Okay. Move on to our next slide there. So the Inspire device is implanted through two small incisions. The first is underneath the chin and then the second is on the chest, just below the clavicle. The procedure takes about 70 minutes to perform and you go home the same day. Most people are back to work and non-strenuous activity within a couple of days. Um, Pain is really mild and is usually managed with Tylenol or with no medications at all. And there are three components to the Inspire. The first portion is the implant, which is placed underneath the skin of your chest. It contains the brains and the battery of the system. And from this implant, there are two wires. The first wire runs under the skin and sits in between the ribs over towards your armpit area. And this is the sensor lead. So it looks at the lungs and senses when you're breathing in during your sleep. The second wire also tunnels underneath the skin and is placed around the hypoglossal nerve under the chin. This is the nerve that controls the muscles of the tongue and the back of the throat. And the Inspire device senses when you're breathing in and gently stimulates the hypoglossal nerve to open the breathing space using the natural movements of the tongue muscles. Next slide. So this is a little video of the first follow-up visit when we're going to activate the device. So we're just looking at the device and making sure that it's activating and moving the tongue appropriately. And then going to set you up with your remote control that you take home and a little bit of information. And what you'll start doing is just go ahead and that night you'll start using the device and you'll just start turning up the strength of the device every couple of nights until it's up to the right setting for you. Very straightforward. Next slide. So I was mentioning before that many of the old surgical options for sleep apnea didn't work very well. But Inspire is clinically proven to work and to work well. This chart shows the average apnea-hypopnea index before and after Inspire. What that means is that before the procedure, the average patient stopped breathing 29 times per hour due to sleep apnea. And 79% of these apneas were eliminated with the Inspire device. Next slide. And again, the patient with sleep apnea is not the only person affected by sleep issues. The bed partner of patients complained of loud, disruptive snoring 83% of the time before Inspire and only 10% of the time after the procedure. So everyone in the bedroom gets better sleep due to Inspire. Next slide. So, I can show you statistic after statistic that shows just how well the Inspire device works. But I think that this slide really demonstrates the single most important fact about the success rate for Inspire. And that is that patients like the therapy and they use it. 94% of patients and families are satisfied with their decision to have the Inspire procedure. They feel better, they sleep better, and they continue to use the device long-term because they can feel the benefits in their everyday use. This is a group of people who had suffered for many years with their sleep apnea, and they tried CPAP as best as they could, but they just couldn't tolerate the mask. And many of them tried dental appliances or the older sleep surgeries, but nothing worked. But then when they eventually found the Inspire implant, it really changed their lives for the better. So specific to the DS community, Inspire has also been tested and proven to be safe and effective. And it really is working incredibly well. Studies are showing that it eliminates somewhere between 86% and 100% of sleep apnea events for patients. And what's more, patients are having improvements in their alertness, their mental acuity, and their just overall quality of life. And we've seen that whereas the average use per week for CPAP for patients is about 20 hours per week, or about 2.5 to 3 hours per night on average. Inspire patients are averaging about 57 hours of use per week, or really getting very close to 8 hours every single night. And one of the real keys here is that device usage isn't completely dependent on the person who has the implant. So family members or caregivers can turn on the device at bedtime for the patient, and it'll be active all night long. You don't have to worry about the patient turning the device off in the middle of the night, or the CPAP mask falls off and has to be adjusted, and you're just not getting the value out of the sleep apnea therapy. Next slide. So as more patients have found success with Inspire, the evidence for how well it works has grown. And with that mounting evidence, the insurance companies have really adopted coverage for Inspire, just like any other procedure for a medical problem. Medicare, as well as most private insurance, now provides full coverage. And certainly, if we were at that point during the evaluation process, my office staff is certainly going to look and work with your insurance to make sure that it's covered before we move forward. Next slide. So is Inspire right for you? So it's indicated for people who have moderate to severe obstructive sleep apnea and who just are unable to get consistent benefit from CPAP. It's for people who aren't significantly overweight, and we would do an airway anatomy exam in my office just to make sure that if we were going to put the implant in for you, that it's going to open up your airway in a way that's going to benefit you. And it's also indicated for people who are currently 18 years or older. So inspiresleep.com is a website that is really a great reference for patients who might be considering this device. There's a ton of useful information about the device, the procedure, and how to, how it's going to affect your life. In addition, Inspire does have a patient ambassador program where you can speak to people who have already had the procedure. And in fact, that is the perfect segue here for me to introduce our next speaker. So Austin is a gentleman who has actually had the Inspire procedure. And I am going to turn the show over to him.
There you go. So I'm Austin Craig. I had the Inspire surgery a few weeks ago. No, sorry, no. Back in April. Back in April, and the surgery went well. It did. They put the 2 incisions on my chest about that long, and one in my neck right here. And after that surgery, they put 2 bandages on my neck and on my chest. I went home that day, and I mostly slept in my parents' room because they had inclines. And so I slept kind of upwards a bit because of the pain and the bandages. And so actually rolled on for a while until my mom and the doctor said that I can take them off. Mom mostly took care of me. When she went back to work, dad took good care of me. But during the recovery time, I mostly watched Netflix, stay in bed. I moved locations. Then after that recovery, I started to go back to work slowly, though, so I can ease back into it. Because when I was still in recovery mode, they didn't want me to lift anything. I can't do anything at all. Just go down and walk. That's all I can do. And so after that recovery time, I went back slowly, nice and easy. And then once I fully recovered, I could go back to my normal routine. And so that's most likely what I did. Back to work, and that felt good. And at the time, I still had to watch how much I'm lifting. And then once he said that I'm all clear, that's when I can lift again and back to work and all that stuff. Um, but overall, though, it went really well. I expected it went better than I expected, I'll say, because um, I I don't know how, but I kind of um restored my energy for my activities, and so I felt much better after I got my surgery and my recovery time done, because I can go back to my normal duties, I would say. Um, so while I was doing my work, I had my coworkers and my boss help help me too. And at school, I was an arm thing because they didn't want me to do anything with that arm. And so it was an arm thing for a while. So I didn't bring my backpack at all. I just got my lunch, my phone, my earpods. That was it.
How is it now?
Right now, it is going really well because when I turn it on, I feel that tightness in my throat, and that's when it's on. Then I wait about 30 minutes until it turns on officially. And when I go to sleep, it feels really good. When I get up, I feel good in the morning. So my I am so happy that I got this Inspire surgery, so I could sleep much better and not be so tired in the morning. Um, so that's how I did in my Inspire recovery. I had, as I was saying, I was an arm thing at school because I couldn't do anything with it. So I went up for a while, and then um and the doctor said once I got more into it, I took it off. I even wore it at the YMCA too. Once I got more into it, I took it off, but I was still kind of um, precaution about the movement with my arm. So I kind of watched it and I lifted my backpack again. So my friends kind of helped me and guided me through that. And, and then, yeah, pretty much it.
Great. Mom, did you have anything you wanted to add?
He explained a fair amount. It really was, I'm going to say, easier than I had expected. I think our biggest reason for doing it was just his moods. He seemed tired a lot, and we'd have the CPAP as a resource. And it wasn't that he refused to wear it. It was just in his
Absolutely.
sleeping pattern, he would take it off in the middle of the night and didn't put it back on. So this allows for him just to go to sleep, and then that's that. And what's super nice is him being a young man, sometimes he'll stay up later than I do, or stays up later than I do.
Yeah.
But it's you can set it so that you make sure if you want 10 hours of sleep or 8 hours of sleep, it'll stay on for that duration. So regardless of what time you actually go to bed, you're going to get a good night's
I
sleep.
set my remote for 10 hours. So when the 10 hours is up, it turns by itself. But when I get for work though, I turn it off manually because I don't want to turn it on while I'm working. So I turn it off manually so I can get up for my day and keep going.
Great. Yeah. So, if anybody else on this call knows Austin, I would call him a gym rat. And certainly my biggest concern about doing this implant for him is that, while you go home the same day and it's really pretty minimal in terms of discomfort and such, you do need to kind of limit the amount of motion you use with that right arm for a few weeks, just because we want to make sure that it's healing in place well before you start doing
Yeah.
bench press and curls and, chin ups. And, I think that was certainly the part that I heard back from Austin when I followed up with him afterwards, is that,
It,
I was ruining his gym routine for a few weeks there.
it was hard, but I said, okay, I'm not gonna work out until I'm fully recovered. I was training my friend, and so I said, okay, I'm not gonna work out. I'll help him, and so that's what I did. I didn't do anything. I helped my friend, but that was it.
So much. So, I think we can move on to the next slide here. So my contact information is on this slide, and I'd be happy to meet with anybody in person to discuss your sleep apnea and whether Inspire might be a good option for you. So thank you everyone for taking time out of your schedule to learn a little bit more about sleep apnea tonight. And thank you again so much to Austin and his family for agreeing to be here and share his story as well. If anybody has any questions for me or for Austin, I think we'd both be happy to try to answer them for you now.
Sounds good. There are a few questions, so I'll start reading them. And Austin, you got a lot of great jobs, good work. Thank you for sharing. So we really appreciate it. Okay, here's the first question. Is it an outpatient procedure for adults with Down syndrome as well, Dr. Layland?
So yes, it is. So for everybody, it's considered an outpatient procedure. So the surgery is about 70 minutes, give or take. It's under general anesthesia, so you're asleep during the procedure while we're doing the implant. Afterwards, we wake you up and we watch in the recovery room for an hour to a few hours, just kind of depending on how quickly you wake up. And but no, then the plan would be that everybody goes home the same day and goes back and sleeps in their own bed that night.
There's another question. Where is your office? So the contact information is on the screen.
Yeah, so my phone number there is on the screen. So we have, my main office is in the professional building attached to Lutheran General. And then we also have a second office in kind of the southeast corner of Buffalo Grove, kind of the Buffalo Grove Riverwoods area.
Who would not be a candidate for Inspire within the DS community?
Well, I think that there are a couple of things that would potentially make somebody not a candidate. The first one is that the Inspire is intended for people with moderate to severe obstructive sleep apnea. So somebody who has very, very mild sleep apnea wouldn't be a candidate. And then the second would be, right now the age is really limited to about 18 and over. I think that will be changing in the coming year or so. But currently it is indicated for people 18 years and older. And then the final thing would be weight. And this is the same thing. It applies to the Down syndrome community as well as to just the general community at large. The implant is allowed for people who are really under a BMI of about 35. That's the body mass index. So it's a relationship between your weight and your height. So it's not indicated and therefore is probably not going to be covered for somebody who has a BMI over about 35.
Mm-hmm. Do patients report any discomfort when the Inspire is turned on and the patient is awake? And do people feel the electrical stimulations to the nerve?
Sure. Did Austin have to take off?
Yeah, I'm sorry. He's overbooked. We had a youth
Yeah.
group, but
this would have been great this is a great one for him to feel. I mean, I can
I can kind of help because I was so curious when it happened. And he said it was never painful. You know, even the recovery right after surgery, he pretty much took Tylenol occasionally, but really, you know, he said when he like at first when he would swallow, it'd feel kind of funny, but never painful. Like he still continued to eat his normal diet. Everything was pretty standard. And then now even when he turns it on, turns it off, he doesn't really feel much. And the one thing was we were concerned like, oh, is it gonna stimulate so much that is it gonna wake him up? And he's never woken up. He's never been disrupted by the device at all.
Yeah, and I think that's a pretty typical response to it. You know, I've found that, you know, some people, when we first turn it on and activate it for them in the office, it's almost they're sort of laughing because it's just kind of a funny situation that all of a sudden your tongue is moving a little bit, even though your brain isn't telling it to. But no, we will titrate it, and you'll actually titrate it at home, so you'll kind of go up and down on the stimulus level a little bit as you need to, and as you get used to it, you'll turn it up a little bit higher. But definitely the goal here is to not turn it up to the point where it's causing any discomfort or it is, you know, waking you up out of sleep at night.
Dr. Layland, there's a question here. Previously, the protocol included an exam under anesthesia to determine if the person was a candidate. It sounds like that is now done in the office without anesthesia. Can you just review the DICE airway exam?
Sure. Yeah. So
that is still protocol.
That is still part of the protocol. Yes. So I would typically, when I'm seeing somebody in the office for the first time, I'll be able to do, you know, a normal ear, nose, and throat exam in the office to get a pretty good idea of if somebody is going to be a candidate or not. But we will still do what's called a DICE, or a drug-induced sleep endoscopy, which is a very brief procedure in a procedure room. It's you have an IV in, and we give you a little bit of medicine through the IV. And while I'm looking at the back of your throat with a tiny little scope, you're drifting off to sleep, and I'm watching the back of your throat and your airway as you start to snore and as you start to obstruct and have apnea. And the reason we do that is because we want to really simulate the best we can what's happening with the back of your throat, because I want to make sure that if we're going to do this procedure and have you recover from it, that it's going to work for you. So we will still do that DICE or that airway exam under some IV sedation as part of the workup.
Perfect, thank you. And I apologize that you guys could not hear the sound on that video. If you go to our website, inspiresleep.com, or download the app on your phone, Inspire Sleep, there are plenty of videos on there as well for patient education. So again, I apologize about that. Also, there's a question here about local doctors in New York. There is a physician finder on our website. So if you live in New York, you can find a doctor there. Then Dr. Layland, there is one more question here for you. I mentioned earlier when I introduced you that you were one of the first programs in the state of Illinois. About how many procedures have you done, and can this be done in a surgery center?
Yes, so we have, and Jen, you probably have the exact numbers, but I believe we have around 85 or 90 people who have had the procedure with me.
Yep. Which is some of the most in the state of Illinois and in the country. So you are one of our experts.
Yeah, so we've done quite a few, and actually we have just recently, within the last couple of months, up to this point, we've always done it at Lutheran, although we've done it in the ambulatory surgery center that's inside of Lutheran. So it's really an outpatient surgery center within the main hospital. But we have started doing them at another freestanding surgical center that's about a mile and a half away from the hospital as well. So that's a very timely question, because we did just start doing the procedure there, which just really adds, extra options for patients in terms of where we can get this taken care of.
Yep. Perfect. I think that covers it. So thank you, Dr. Layland. Thank you, Austin and Melissa. We really appreciate it. And thank you to all participants for joining. Again, if you would like to see Dr. Layland, his information is here, and have a great night.
Thank you so much, everyone.
Thanks, everybody. Bye.